Welcome to Habitual Excellence, presented by Value Capture. This podcast and our company helps you and your team achieve habitual excellence and get better every day by focusing on one clear goal, one set of values, and one way of working. In simple terms, we want to help you create more value by providing the best care and the safest environment for both patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
Welcome, listeners. Most of you know by now, but I'm Ken Siegel. I'm the Chief Relationship Officer for Value Capture. And this is the Habitual Excellence podcast. And I'm excited by this podcast today because we have as a guest Carrie Willetts, who serves as the Chief Administrative Officer for West Virginia University. She has moved into that role very recently after coming to the university in another C-suite role. But is a fast riser for all the good reasons of people-centered leadership and pursuing a vision very effectively. And I'm excited for our discussion today, where we're going to talk about how leaders, I think, can use the habitual excellence principles to lead from purpose to strategy to execution really successfully. And Carrie has a way with words. So Carrie, thank you for joining us to share some learnings with your peers today on the pod.
Happy to be here with you, Ken, and really excited for our conversation.
Well, you and I haven't known each other personally terribly long, but our team has noticed you for years and years, going back to when you were running a hospital for WellSpan, et cetera. And, you know, we've gotten the chance to see you across a couple stops and learn more about you over time. But will you share some more of your background, how you came to healthcare, how you worked your way up, and sort of what brought you to WVU for our listeners?
Sure. As a little girl growing up in rural West Virginia, I always knew that I wanted to work in healthcare. But really my exposure to healthcare professions was very basic and simple. I felt like I could either be a doctor or a nurse. And so when I chose to go to college, I started my college career actually at Mary Washington. It's now university. When I was there, it was Mary Washington College in Fredericksburg, Virginia. I was a chemistry major.
Yeah.
After I transitioned or transferred to James Madison University after my freshman year, because I realized all my friends at Mary Washington went there on the weekend. So I figured, well, if everyone's there on the weekend, I might as well be there too. So it was there that I discovered the field of healthcare administration accidentally. I asked a girl that I met in one of my elected courses what her major was. And she said, healthcare administration. And my response was, what's that? And she said, well, you should take this one credit course and they'll teach you all about it. It's basically the business of healthcare. And so that's what I did and transitioned my major to healthcare administration from there. We were required to have an administrative internship as part of that undergraduate program. And I selected University of Virginia Health System. So started my career there, worked primarily in what is known today as UVA Physicians. At the time, it was called the Health Services Foundation, and then was in my first leadership role as administrative director of the Physical Medicine and Rehabilitation Department. After, about 8 years in academic medicine, I wanted to understand what it was like to work in a nonprofit community setting. So I found a job actually it was at the time when hospitals, really before a lot of mergers, but it was sort of in the time of the Bill Clinton era of HMOs. And so hospitals were starting to acquire physician practices focused primarily in primary care. So I found a job with Rockingham Memorial Hospital just over the mountain from Charlottesville in Harrisonburg, Virginia, of course, where I went to college. And I ran their physician billing and compliance division because at the time they didn't really have that core competency of physician practice management, and so I was able to offer that. And from there, was given lots of opportunities to grow as a leader. That was probably the most profound time of growth in my career. I would say I know the term now is sponsorship, but I had 2 women who sponsored me, and they saw something in me that I didn't see in myself, and then they gave me opportunities that I would have otherwise not been, provided. So I ended up there becoming a director of strategic planning. And during that strategic planning cycle, we decided to pick a partner for the future, which was Sentara Healthcare. From that role, I was then an orthopedic service line leader in orthopedics, and then was recruited down to the Tidewater area of Virginia to be a vice president of operations. That's kind of my first foray into hospital-based operations was with Sentara. I thought I would spend my entire career at Sentara, but was called by a recruiter to visit Ephrata Community Hospital in Lancaster, Pennsylvania, and I just accepted the trip because I'd never been to Lancaster before. And I had a mentor once that said, hey, go on a job interview every 3 years, just not because you're looking for a job, but to keep your skills up so you know what other organizations are looking for. And but it turned out I accepted that role. And that's where I met Value Capture.
That's right.
So I, ascended as a regional, a market president at WellSpan before I took my role before I joined WVU Medicine in October of 2022.
So you know your stuff, and you've been in many different settings. Just tell people briefly what the role means. You have a funny way of describing what people think when they hear Chief Administrative Officer, but tell us what it means at WVU Medicine.
Well, my funny way is, I said to my CEO one day, this is the other duties as assigned job responsibility, which makes it really fun. Someone else described me as the utility player.
Mm-hmm.
But, really, if I had to, just sort of take a broad lens of what my role is, my role is to help all of the parts and pieces of this now 25 hospital, soon to be just 2 large practice plan, integrated delivery and finance system, help all of the operational parts and pieces work together. So under my scope is what we're calling the system medical group. So that's the non-academic practice plan, which currently has over 800 physicians and APPs, and by the end of 2026, we will have doubled that number. And we're doubling that because every time we acquire a hospital, that hospital has a corresponding medical group. And so we're working to align the cultures of our medical group, so therefore we can really begin to transform care. I also have responsibility for the other end, the post-acute division. So that includes home health, hospice, and durable medical equipment. We span 4 states. And so, follow all the rules and regulations as well, but try to be really partners in value to our health system. That's really our primary purpose in post-acute. And then I have this little agile team called the that's responsible for health system integration.
Yeah.
So we describe our role as when we integrate. So we onboard any new hospital. So right now we're integrating Weirton Medical Center, which is over a 250-bed hospital in the most northern part of West Virginia, just about 20 minutes from the Pittsburgh airport. And we project manage that, and really that is really focused on the experience of our new partners, and together bringing value to both entities to this new relationship sooner. In the past, the integration was a little bit more transactional, and we've worked really hard to make sure that it's value added very early in the relationship. I really think we have a best practice there. We say we optimize, and so we work with our service line institutes to help optimize access and care delivery across the 4-state region that we serve. And then we do other we really serve as an internal consulting group to help the health system, again, kind of all the parts and pieces work together. Soon we'll be standing up an access strategy and really focused on creating access being a partner to primary care physicians and other referring physicians within our network to help them navigate our specialist network throughout the system. So excited about that work.
Yeah. Well, Carrie, in your excitement, I think our audience won't be surprised to learn that you're known as a builder of systems. And I think people are also, if they weren't aware, waking up to the scale and scope and ambition of what WV Medicine has accomplished over the last couple decades. And we'll be talking a little bit more about what's ahead for WV Medicine. You and I were learning down at Duke together last week, and they certainly had taken note of the accomplishments of WV Medicine, and I know that was encouraging to hear. Let me ask you a question. You have, as a leader, one of the things we really talk about a lot is the leader has to have a framework in mind to lead by, to allow people to accomplish great things together. And you've always had that. You have a way of thinking about what's most important, and then a way of sort of helping large groups of people pursue that together. Could you sort of share your leadership framework with the guests? Because I think it's so helpful and so practical to hear it.
Sure, it is practical. And, I have to say it's really an adapted framework from a book that I read years ago called The First 90 Days, if anyone's familiar with that book. So really, my little formula is I have a saying, culture is the solution to blank, fill in the blank. And my formula that I apply to sort of, number one, assessing the current culture of any organization that I step into as a new leader, one, assessing the culture, then setting a vision for the future, and then moving the culture to get, therefore, to achieve the outcomes that we want is this. One is, first and foremost, I'm very intentional about taking the first 90 days. I usually call it a listening tour, of really listening to all the perspectives about the organization or the situation or the division that I'm leading. I ask similar questions to the stakeholders so that then I can really tease out the trends and themes and have a full, I think, my goal is to create a full 360 point of view of whatever the situation is. So, I ask up front, what is the purpose of the organization from their point of view? And really, I do that to check for alignment because it's interesting to, we may or may not all describe the purpose or the why, why we're doing something. Then I ask within that purpose, based on their definition of the purpose, what do they think? What do we think we do well today that what should we keep doing? And then where are there opportunities for improvements? And then I ask whoever the stakeholder is to kind of think forward 3 to 5 years from now. Where should we be as an organization, as a division, et cetera? And what are the core capabilities? I'm very intentional about not what should we do, but what are the core capabilities and competencies that we should be building? So from there, usually I can cast a pretty good vision and then outline the top 1, 2, or 3 priorities that then I need to focus on rallying the team around. I'm pretty intentional about using words, the language of the organization, so in informing the priorities and goals so that they resonate with the stakeholders, and also that they can hear themselves, their feedback in the work as I kind of feed it back to them. I really have very few original ideas. I'm just really good at collecting all the ideas and helping people prioritize and put them in a format. I think probably the differentiating work that I do is work with the team on their role and how their role contributes to the greater purpose. And I'm not real specific in that, in task oriented, but it's their role in the work. So I have a little tool that honestly I was given in my first leadership role back at Rockingham Memorial Hospital. I've taken with me. It's called a Role Clarity Document. I use it as a starting point when I work with leaders to assess how they're spending their time. And then I have them evaluate, okay, if I'm a vice president, then my primary goal should be removing barriers for my team members, coaching, developing leaders, executing strategy, right? And so if they do an assessment of the last 2 weeks of their work and 80% of their time isn't spent doing those things, then I have them ask the question, why? Is it because I have new leaders on my team and I'm teaching you how to, well, that makes sense. Is it because I'm doing the role of the director and I shouldn't be? And what do I need to do to pull myself up? And then from there, we create leader standard work. And so with my teams, I introduce leader standard work very early as just really a guide. And also I introduce the concept of reflection. And I myself have had a habit of reflection, pretty intentional habit of reflection throughout my career that I found it valuable. And so I encourage folks to create a habit of reflection in their work. So really that's it. It's cast a vision, create relevance. It's really about creating relevance for the role, regardless of what your role is in the organization. You have to see how your work connects to the bigger purpose.
Yeah.
And then providing a general roadmap of priorities. And then, as I say, get out of the way and, cheer folks on, give them where I see gaps in competencies and capabilities, coaching along the way. But then honestly, really the rest takes care of itself.
Carrie, I'm coming out of my chair, and I'm sure others are too, because again, it's so practical and clear, and from a leadership perspective, it embodies so many of those great qualities and practices that you see in the greatest leaders, and you're not acting like it's something handed down from the Greek gods or something. It's so doable. And there's another thing we've observed and that you've observed about yourself from this point, which is kind of get going. Like you say one of the things that distinguishes you is you're okay with things being messy. Could you talk a little bit about that critical part of this little cycle you're describing?
Oh, sure. I think if you're intentional about setting direction, so I'll use an example of Uniontown Hospital when I came there, and that's, I'm still serving, in addition to my role as Chief Administrative Officer, I'm still the President and CEO of Uniontown Hospital until June. Yeah. One thing I figured out about that group after doing a sort of 90-day assessment is that we were not stable as an organization. And I knew that we could not improve. I think this is a concept I probably learned from value capture is you have to stabilize before you can improve, right? And so you had to create some sort of a way, some sort of a standard before you can improve the standard. So one thing I kind of issued for them is what I called a stabilizing vision. Is super simple. We need to be proven because we use data to inform nothing at the time. And so proven to me says we are going to use data to inform whether we're successful or where we need to focus. We're going to be proven as a great place to work because we had very low employee engagement at the time, and receive healthcare because that's, really our purpose, and our quality wasn't what it should have been. And then engagement was focused on, we did only a daily huddle in each unit and a daily safety brief. And we focused on a culture of safety, and our metrics of success were 5. We went from 50 metrics that we improved to 5. So I share that because, I'm intentional about, even if it's simple, is nothing super profound. It probably sounded like every other vision that every other hospital had, but I knew that it would resonate with that team. Yeah. And so then with these measures, I can directionally kind of know and sense and feel if we're moving in the right direction. And where I say that I'm fine with messy is as long as we're learning. If somebody tried something and we didn't get the outcome that we wanted, but we understood why, then to me that's a success, right? And we learned that from value capture also. And so I would much rather be moving forward and learning than over analyzing a situation to death on a piece of paper and not moving forward. I love the term flow. I like to flow. So a lot of what I do is through intuition and maybe experience and things like that. But
no,
I'm fine with messy. Messy isn't failing. You just have to be comfortable with a little messy as long as you see that things are moving moving.
I love it. And I love how you wade toward the actual work and the messiness of it. And that's inspiring to people and makes them feel safe. And we see so many institutions where the teams overanalyze for months after months because they're scared. They feel like they have to put the best plan possible on PowerPoints in front of the senior team. And so often it's really fiction. It's a fictional conversation. And you sort of embodied the opposite of that. And I hope other leaders take your example because it really does produce faster, real results. I know you have a lot of pride about some of the results that the team at Uniontown went on, and again, your framework, simpler is always better. You share just a little bit of a couple of the achievements down there, just so people get a sense of that.
Well, probably what I'm most proud of is our employee engagement results. When I arrived at Uniontown in October of 2022, we had just received employee engagement survey results. It was a really good, frame of reference for me. We were performing in the 9th percentile. So, one benefit was there's the only way up, but so we just resurveyed and we're above the median now. And we were leading above the overall engagement. While the whole entire health system improved their engagement, we were above. We scored better than the above others, and we were one of only 5 of our 25 hospitals to see statistically significant improvement. I would say the metric that I'm most proud of, however, within that engagement survey is our team member sense of belonging. That we're in the top, quartile performance for a sense of belonging. And to me, that's psychological safety, right? And we've created an environment where people are involved in the work. They aren't afraid to speak up, to ask questions, and to me, that is an indication that we have an environment of trust, and we will only keep improving from there. So that's really exciting. In our quality metrics, we had, I think the year prior, in 2022, I think we had 75 serious events. Last year we had 17, and this year so far, our year starts in January, we've had 0. And so, you look for sustainability. We started with those 5 metrics, and we've now expanded those to include, mortality. We're well below our observed over expected, and we've sustained that in our mortality rates. So in the Vizient database, in our classification of hospital, which is the community hospital, we went from second to last. There are over 300, almost 350 hospitals. We went from second to last to the 64th percentile. To 64, number 64, excuse me. So anyway, we've
right a bit higher than that.
We've done that, and I think we'll continue to improve. And then finally, we've had a financial turnaround as well. We ended 2023 with a $12 million deficit, and we broke even last year. Actually, we made $69,000 last year in 2024. So
fantastic. And done amazing things with the support of the health system, like reopening OBGYN care in a rural community and things like that. So, and these are characteristic of the results you get. And, and if people heard, culture is the answer, and you can hear the results coming. And thank you for providing such a detailed answer. All right, we talked about you being comfortable in the mess at the execution level, but as part of your strategy of developing your people and moving toward the great goals once you've clarified them. But you're also very comfortable with strategy. And, we both talk that a lot of leaders who like habitual excellence principles sometimes are more comfortable at one end or the other, right? And you seem to be able to encompass both. And I wonder, it's hard maybe because you reflect, I wonder if you have any reflections about you as a leader, about why you're comfortable at both ends, or how you link them in a way, again, that other peers who would like to be strong in the connection between them might learn from.
That's a great question. I think part of it is just my experience. So some by chance, I've had the opportunity to have operational roles as well as, I was a director of strategic planning. So I was taught well by mentors and those above me in how to develop strategy, et cetera. But I think just intuitively, as a leader, I've paid attention, early in my career, I paid attention to what was important to the CEO.
Mm-hmm.
And what specifically just to the words they used. And I would write them down. I had a habit early in my career of reusing their words, but over time, as I've matured, I've learned to then kind of visualize what that means for me and my team, and then repeating them. To make them my own, to come to life.
Yeah.
And then the third part is I just always believe in the strategy and the direction of the organization. Some strategies resonate with me more than others, but I work to understand the why behind the strategy. So that's probably most important rather than arguing with it, understanding first, what are we really trying to accomplish from this strategy, and what does that mean to my team? And if I can think through that myself, then I can translate the strategy into operational execution for my team. So I want to try to I can think of an example. Here's an example of applying sort of this concept at Uniontown.
Yeah.
So when I came, I came to WVU Medicine, we could talk more about this later, because I heard my CEO, Albert Wright, on a podcast once, and he was really describing the potential of our health system.
Yep.
And we believe we have the potential to really change the health trajectory of the populations that we serve. Who traditionally we're probably the only health system that serves a complete geography of Appalachia. And so, traditionally we've had poor health outcomes, and we believe we're in this position where we can actually have a positive effect on poor outcomes. And so I come to the health system and to my role at Uniontown from that lens. Second of all, he describes, we started a payer about 2 years ago. And to me, that was the final kind of, that's going to be the secret sauce to our ability to truly influence how care is delivered and create value, which we all talk about, but I can see it. I can see how it can work. And so then my job was to translate that into what that means for Uniontown Hospital. So I know we ultimately are here to change the health trajectory, which makes me excited every day to come to work. 2, we do that by being a highly integrated health and finance system. And so then to my team, how do I bring them to understand their role as an integrated partner? What is our role in this integration? So as I said, I mentioned, we had to have a stabilizing vision first because we weren't getting the outcomes that we needed in order to be a value partner to the rest of our health system. So we're getting that now. And over the last year and a half, I've been now moving our team members toward being an integrated partner with the rest of our health system. So what does that mean? Well, we're a community hospital. What role can a community hospital have in integrating into a larger academic hub? Well, one is we can take referrals from smaller critical access hospitals that we're capable of caring for, so that we can save the beds at our large academic institute for the large trauma, tertiary, and quaternary care services. So that's one thing that we've positioned our team to do, is to receive referrals from other hospitals that are close to us that do not have the capabilities of Uniontown. And then what I do is I reiterate the message by sharing the story and telling the story about how we accepted this, but then also meeting with the stakeholders to understand how can we improve our direct admit process from our hospitals to make sure that it's a good experience for them. And when I first started talking about this, people looked at me like I was crazy because people were overwhelmed and busy. And they're like, well, wait, we can't even take care of our own patients. How are we going to take care of other patients? So you just keep, telling the story. Yeah. It's one patient at a time. So, that's what I think I spend time really really kind of understanding the purpose of the organization, very purpose-driven leader, what the strategies are, what the steps are to get there, and then translating that for my team, and then making it, again, relevant for them, and then looping around with stories that people can understand and relate to.
Well, what a beautiful example of going from purpose to strategy to execution, and right off the top of your head. And and again, this is an ingrained cycle for you. And I think young leaders who are listening to this, you're getting a master class here, and we want Carrie to just keep talking. Carrie, let's pull a couple threads out of this. So you mentioned how you came to WVU, and another thing we've observed for you is you are always so deeply anchored in purpose of the organization, but also coming from your purpose, which you highlighted a little bit as you introduced yourself. Can you tell a little bit more about how you came to WVU and tying to your purpose as a person, a professional, professionally and as a leader?
Sure. We'll start with my purpose as a leader, and I'll be quick. I probably about 10 years into my career, I kind of hit a wall, I think, on finding, I think, value in the work in my contribution, not understanding. And it was primarily driven by the fact that I don't have a clinical degree. And so I was working in this healthcare world, and I'm not saving lives. I'm not treating patients. So what value do I add? I'm a quote administrator. And so I read the book, the Simon Sinek book called Start With Why. I read that, and I worked through the exercise of why am I here, and I realized I'm here to help others reach their full potential, and I thought more about that, and found that what I'm really passionate about and good at is coaching others, the people who report directly to me, and then also to reach their full potential. And I also really find great joy and value when I watch those leaders work with their teams to reach their full potential. And so what I've landed on is my purpose as a leader is to help others reach their full potential, either as individuals, as organizations that I've had the opportunity to lead. And now I really feel that this connection to WVU Medicine, that we are in a position to really help populations of people, whole communities of people, reach their full potential. So along those lines, I think I was maybe 5 years ago in my career, probably coming out of COVID. None of us had traveled for a while. We hadn't really, I realized that my professional network had grown quite limited to the fine people that I worked with at WellSpan, but no one really outside of WellSpan. And so I attended a conference or two, and I felt like I wanted to build a little more intentional relationships, be more intentional in developing my network. And so I made a list of what I called my list of humanitarian CEOs, health system CEOs. And, it was a list of a variety of folks who led a variety of size and scoped organizations. And one of the people on that list was Albert Wright, who is the CEO of WVU Medicine. And, I had heard him on a Becker's podcast a few months prior, and heard in his voice, heard him describe basically this driving purpose, this purposeful vision to really change the health trajectory of West Virginians. And so I decided to email all the health system CEOs that I had on the list, and just particularly to Albert, I reached out to thank him as a native of West Virginia. A lot of the press, including the sports press, unfortunately, is negative that you read and hear about West Virginia. And so really my message to him was thank you for doing something positive and telling others about it on behalf of the state of West Virginia. And, as a fellow healthcare leader, I wasn't looking for a job. I just said, hey, this is this is me. I would love us to connect. I'm looking to build my professional network. All of these CEOs, all of the health system CEOs responded back to me within that day. And every one of them I had a video conference with, and Albert and another CEO invited me to go down to their and meet members of their team. And so I did that with both health systems. I learned a lot. And in the other health system, I still stay in contact with some of those folks that I met. And then ultimately, really a year later, it resulted in a job opportunity here with me. But it really was about building my professional network with like-minded organizations, with health system CEOs who kind of in positions above me that I really respected and looked up to. So anyway, that was probably one of the bravest things I'd ever done. But I thought, why not? I had no idea they would all respond to me. And I had lovely connections with each of them, and was frankly overwhelmed that they would take the time to talk to me.
I love the story. And I think, you mentioned earlier, you're excited to get to work every day, and for everybody wants that, right? And for many in healthcare who may have been feeling less that way, I think, you're giving again the formula to not end up feeling stuck, but to anchor deeply in purpose. And I think many people want to turn in that direction, and maybe your story will give more folks the same kind of courage to apply the same kind of thinking. You brought us to WVU Medicine, and we've heard a little bit about what's been accomplished in the scale of moving behind that vision of changing the health prospects of West Virginia and West Virginians. And, I know when I came to Western Pennsylvania now almost 30 years ago, I certainly noticed that from a primary health standpoint, the folks in Northern West Virginia were doing better than the folks in the Southern Pennsylvania counties. And I learned that WVU Medicine, together with the public health infrastructure in West Virginia, had a lot to do with that. And certainly have only been impressed since. But can you share a little bit? You're excited to get to work in the morning to help accomplish the next steps in that. You've alluded to integrated payment. You were down learning with leaders from Kaiser, at Duke this week, et cetera. But what else? What else is in the sights? And, for people who want to be inspired behind that vision, what should they know about WVU Medicine and what's coming?
Mm-hmm. Well, first of all, WVU Medicine is anchored by state-of-the-art, best-in-class, world-class institutes, which I'm not sure that everyone is aware of. So the Rockefeller Neuroscience Institute, our Heart and Vascular Institute, and WVU Children's, as well as our Cancer Institute. We are, for example, in our Rockefeller Neurosciences Institute, the executive chair, his name is Ali Rezai. He is an extremely purpose-driven neurosurgeon who has cutting-edge therapy for treating tremors, for Parkinson's patients, Alzheimer's patients, and addiction. And if anyone has interest, you can find a 60 Minutes segment that features his work, which is, you may cry. I mean, it's so inspiring, the work that he's doing, a 10-minute treatment that can break a cycle of addiction, in addition to all these. So what I don't think people realize is some of the cutting edge, practical and applicable research and clinical work that we're doing here. We also are the premier center for robotic heart surgery. Dr. Vinay Badwar is our executive chair, and he trains, all the Ivies really, and we host world conferences around that work. We also, I think, so and then we have this network of hospitals, of course, 25 hospitals, 11 of which are critical access hospitals. And one of our, kind of tenets when we acquire a hospital is that we really assess the needs of the community and work to infuse, and oftentimes we reintroduce services back into the community because it's the right thing to do. Our goal is to push care as close to the patient as we can. We're in a very rural area. The roads are sometimes difficult to get to. So for example, at Uniontown, At one point prior to WVU Medicine, the decision was made to close the labor and delivery unit.
Right.
At the time, we were delivering 800 babies a year. We just felt like it wasn't financially viable at the time. So we just recently in January reopened that service. We won't make money on that service, but it's the right thing to do. We have 1,200 moms, we believe, in Fayette County who have babies every year, and they need to have a place to locally to have their babies safely. So I think that's something, and I've been interviewed by leaders at the state in Pennsylvania asking, what makes it different? Why did we do this when other health systems aren't? And there's a variety of reasons based, our proximity to the academic hub, et cetera, et cetera. But I'd say we have a culture that one of just do the right thing, but also I think we have a little bit higher of tolerance of risk that maybe other health systems might not have. So, you have to figure out what the right formula is for you and your health system. But, our CEO sets that tone, and we do the right thing and we do it wisely. Now, along those lines, we have a very low overhead. Our corporate overhead is 7.5%. It's extremely low. We have a lot of autonomy and responsibility at the local level. And so, where a lot of systems are extremely centralized in their system, we're a bit more intentional about where we have system and where we systematize and where we don't. However, through my integration role, now we're starting to identify where we have pockets of great and figuring out our models for scale, right? To scale. Because I think, as I'm saying, there's this pull for systemness, so it's happening naturally. Rather than it kind of for people to feel like it's being forced upon them. Especially we're relatively new. Our health system really grew in the last 10 years. So from 6 to 25 hospitals. So we've been in the acquisition mode. So now that things are slowing down, it gives us time to breathe. And folks are saying, hey, let's work together to solve this problem. Let's work together to solve this problem now, rather than someone saying, hey, here's our formula and how we do it. So we're kind of fortunate in that way.
Well, sorry, I didn't mean to cut you off, Carrie.
No, that's it. I would just say, I think it comes back to culture, right? I said culture is the solution, and it comes back to the culture of the organization, and we just don't make things too hard or too complicated, and we do the right thing.
Well, and those again, values anchored, simple rules to live by that people can apply in their own work turn out to have more to do with high performance over time than a million regulations, coming out centrally. So a lot more positive. So, and some wonderful hints about why WVU Medicine is accomplishing what it has already and coming. So pay attention, everybody. We could talk all day, but I'm going to ask you one final question, and it's picking up on something that you mentioned a couple times, and that was mentors. And you mentioned several mentors you've had, including some female mentors. A couple times you made a note of that, and you've had mentors who are female, male, et cetera, I'm sure. But for you as a leader continuing to grow, what has been the place of mentors, and what would you say to young leaders coming up, male, female, otherwise, or maybe especially female leaders, about their importance and role and how to think about it?
Oh, that's a great question. I think I've kind of changed my mindset from this concept of mentorship to sponsorship.
Okay.
And, when someone asks you to mentor them or you ask them to mentor, they're going to, it to me seems, if you're seeking mentorship, one, as a mentor, be honest with don't be too hard on the person, but be honest with the person. And vice versa. Right. The whole concept of sponsorship is really, in my opinion, about picking that one person that you see something in them that they don't see in themselves, and then giving them the opportunity to try something new, and then cheering them on. When I've been, quote, sponsored to something, that's built my confidence more than any, dialogue or advice that a mentor has given me. Because number one, they picked me to do it, and I would, but most importantly is I didn't want to let them down. And
Right.
so, just your confidence just accelerates when someone invites you to try to a new table, not to do the same work that you've been doing over and over again. But so my guidance for mentors and others is to, pay it forward. Somebody's probably sponsored you along the way. And, this whole experience I had with health system executive CEOs of huge health systems who took the time on a Sunday afternoon to have a call with me, that I must pay that forward. It's an obligation, I think, for me to pay that forward. And then two, to, really seek opportunities to sponsor or to sponsor others, because then it will become contagious rather than mentoring advice and things like that.
Well, another fantastic tip about how to think about a concept that we hear about a lot of times, and I'm sure listeners like me will hear some of the foundation principles sort of cutting through all of this stuff, and that learn by doing, and that stretching under the safe guidance of somebody with more experience. So wonderful. Carrie, thank you so much for being here and for sharing some of the deep wisdom and experience that those of us who get to work with you have seen for a long time, and are so glad that the people of West Virginia right now, but all of American medicine, are getting to learn from you and learn with you. We appreciate you coming on so much.
Thank you, Ken. It was a pleasure.
If for the listeners, pay attention to what's going on down at WVU Medicine and Carrie's work. The health system is big on results and modest on ego, which is how we like them. But tons to learn. And similarly, if you want to gain some other resources around these ideas, check out the Value Capture website, valuecapturellc.com. Please like the podcast, subscribe on wherever you like to listen to it, and stay in learning partnership with all of us. Thanks, everybody, for joining us.
Thanks for listening to Habitual Excellence by Value Capture. We hope you'll subscribe to the podcast. Please also rate and review it in your favorite podcast app. To learn more about Value Capture and how we can help your organization on a journey to habitual excellence, visit our website at www.valuecapturellc.com.